Okay, hey guys. So the disability that I decided to research on was the cerebral palsy syndrome. So if you click right over here, it's gonna direct you to the site. So the site pretty much tells you what it's about and what are the symptoms, the cases, and the categories of the cerebral palsy syndrome. And there's also the diagnosis and many more diagnoses about um, referring to cerebral palsy syndrome and the treatment. And yeah, and if you want more information, just click on this site. Okay, so this the organization name is Merck Manual Professional Version. The objective of the site is to inform what cerebral palsy syndrome is and to elaborate what it is. The description of the site are in a category. It also gives out information where they can lead you to another link to explain more about it. The site overall is great because it gave me more information about this disability and I liked how it was organized into categories because it made it seem more easier for me to find out where the information was from. Okay, so two possible websites that might be useful for research would be the Mayo Clinic and the NHS website. These two websites are useful because they provide information such as the treatment that are available for this type of disability. Okay, so the definition of a cerebral palsy, or also known as CP, is a group of syndromes that causes non-progressive spasticity, ataxia, or involuntary movements. It is not a specific disorder or single syndrome. The symptoms are seeming too stiff or too floppy, weak arms or legs, lack of muscle coordination, difficulty in walking, such as walking on toes, difficulty with sucking and eating, tremors or involuntary movements, seizures, and delays in speech development or difficulty speaking. So the causes would be mutations, maternal infections, fetal stroke, infant infections, traumatic head injury, and lack of oxygen. So there's currently no cure for CP, but treatments are available to help people with the condition have a normal and independent life as possible. Treatments include physiotherapy and occupational therapy. So about the history, about 25% of patients, most often with spasticity, have other manifestation. So how does it affect the learning ability? It would affect the learning ability because it would be hard for them to move around since they are weak and they have trouble with the vision and trouble speaking. And that's all. Thank you.